So when somebody comes to you and says, "Look, I'm overwhelmed," and it's interesting because we've done this with Dr. Tabitha Healy, who is an oncologist who burnt out and shared some shocking statistics. I mean,
Yeah.
like 40% of doctors and 60% of nurses are burnt out, and she used the acronym DIE: disengaged, ineffective, and exhausted.
Yep.
But where do you start with somebody who comes to you and says, I think I've got burnout. Where do you start?
As practitioners, we see a lot of people with burnout. Even just the global kind of indexes shows that 64% of anyone who has a job is in.
As a patient, as patients, we're
Yes,
saying,
as patients are burnt out.
yep, yes,
And so we can identify it in other people way quicker than we can identify it in
yes,
ourselves.
yes.
And so often is the case that we talk about popping a mirror up to yourself. If you were your own patient, what would you do right now? What's the advice that you would give? What's the listening ear that you would have? And more often than not, that's a really great starting point, because you're starting to recognize in actual fact you are showing signs and symptoms, and you are exhibiting the types of things that you see consistently in front of you. The other part of it is having somebody to talk to. Loneliness is an epidemic at the moment, and there is so many other statistics around being alone and being a solo practitioner or a solo small business owner. It's one of the bigger burdens that we have that can quite quickly be changed if we reach out to somebody, a colleague, a previous, somebody who's been in a qualification when we were a student, a mentor that we've been looking up to. And we're really lucky in the natural health world. We have some really large online professional groups that and I run one of those, that create space for people to talk and debrief and connect with other practitioners who are like-minded and in a similar kind of position or have been in the past, and can, share some wisdom on what's the next steps. The part after that is generally taking time out. And one of the things that we talk about in the profession is having either a radical sabbatical or blocking out just at least 1 week where you can recuperate on the back end of your booking system, just blocking it out, having that time out to recuperate, have a debriefing conversation, talk to somebody who has been in this experience before, whether it's a colleague, or seeking that professional help if you have got that notion that burnout is showing signs and symptoms of something a little bit deeper and darker. It's a really important thing to have some time out to be able to talk to somebody professional about it.
I've always felt I've always felt that there's a point of diminishing returns that a lot of practitioners, I think a lot of people in business, quite frankly, but certainly in healthcare, do not understand. And this comes back to your transactional and transformational approach. Transactional is pretty easy in many ways. I mean, it's stressful in some ways, but hey, come in, give me your symptom. We know the game here. Don't have too high expectation. You came in for a prescription. I'm giving you a prescription. It may be the latest or the greatest medication according to the last drug rep that was in to see me, but here it is. And that's one way. But transformational requires a lot of mental energy, and there's a point of diminishing returns. So by that I mean you shouldn't. I mean, I've always said this in our practice. I don't think a dentist should work more than 4 days a week.
Yeah, I'm with you. Yes.
If you are willing to give patients the time and energy that they deserve, you need the mental energy to deal with that.
Yeah.
And so, 4 days max. After that, you just can't wait to get the patient out of the chair. Just give it to me quickly. I'll give you the script. I'll fix whatever needs fixing. Just go. And that would be your attitude. So there's a sweet spot there, isn't there? And I always think, there's a point of diminishing returns.